Well, if you've ever dealt with heartburn, you know it's no fun at all. The acidic feeling of fullness that won't go away. For as many people out there, as many as 20% of the population, those symptoms are chronic. But a new minimally invasive procedure could stop the burn for good. Katrin Asaf joining now in the studio with more on this. Katrin, interesting stuff.
Yeah, it's really interesting, Bob. You know, what we're talking about is referred to as GERD. It's a chronic condition that's a lot more common than you think. And if you have to take over-the-counter anti-reflux medication more than twice a week, it interferes with your quality of life. Or if you have a family history of esophageal or gastric cancer, then you may be at risk for GERD and may want to hear about this new solution.
If it's a small hiatal hernia, then he'll go in first.
After years of helping patients trust their gut, gastroenterologist Dr. Ali Khan has seen a thing or two, from the exceptional to the typical.
The vast majority of us do encounter symptoms of what we call heartburn or acid reflux.
That uncomfortable burn after a spicy meal or a night out. But for some, it's more than just a minor flare-up.
If it becomes more frequent and becomes a more recurrent problem, then it's called gastroesophageal reflux disease, which is something that we would need to investigate further.
GERD, something as much as 20% of Americans struggle with. Anti-reflux medication can easily be found in any pharmacy, but for a few,
some things I think we have to let the doctor handle.
And that's where Dr. Khan comes in with a groundbreaking operation, fixing the problem from the inside out.
This new procedure that we're offering first in the state is called a concomitant transoral, so it's through the mouth, incisionless, so we don't do any cutting, fundoplication.
The surgery fixes anatomical issues that cause GERD. First, patching up any hernias, then turning to the area between the stomach and esophagus.
And we reinforce that valve, recreating the natural anatomy that we're born with.
Stopping reflux at the source, improving quality of life, and possibly even extending it.
In other patients, you're preventing esophageal cancer.
So when that minor spark turns into a daily burn, it doesn't have to mean years of symptoms and pills. The best thing to do, trust your gut and leave it to the experts.
The first step is to see a gastroenterologist.
Yeah, that's the first step. And of course, surgery isn't necessarily the best solution for everyone. Things like avoiding tobacco and alcohol, losing weight, or just having smaller meals could fix the problem by itself. The best advice is if you're struggling, of course, go see your doctor. Bob.